Thank you for inviting me to these grand rounds, to this presentation. I'm glad to be here. I don't quite recognize the place, but I was here before. I was here some time before. Let me bring you some memories from the past. From the time I was here, you notice that was 74, 75. I was a resident at the Allen. This is me. I'm sure you recognize me right away, no? There are some people, this is Claude de Montigny, who was a good friend of mine at the time. I think Mike Bond is here. Is he around? No? Yes. No? Is anybody?
The Jewish, not here.
Oh. Is anybody around? I can't remember everybody, but we were a lot of people like, you know, that was the 70s. That's the type of hair we used to wear at the time. And this is Gail Hennings. I can't remember everybody, but I wish I could meet some of them because I have very fond memories of all those years. But of course, my main training was at the General. I'm here a few years ago. I kept returning to Canada. And a few years ago, I met with three of my mentors. This is Dr. Rockefeller, and this is Dr. Negrete, and this is Dr. Sam Lal. I'm sorry, I learned that he is dead now, but he was a very good teacher and introduced me to consultation and also to neuroendocrine research. We did one of the few papers ever on prolactin secretion induced by neuroleptics. That was, did our work in the 70s. This picture was taken in 1990 something. And getting into my talk, this is Wolfgang Lütte. This is Wolfgang Lütte, that is the workshop. He used to give a workshop, an introductory workshop on method of autogenic therapy. And it was one of those workshops. I don't think it was a workshop, it was a presentation. It was given here at the Allen. And I was in the audience. I was resident at the time, and I was interested with what he was talking, what he was telling about autogenic methods. Autogenic, you know, means self-generated. He was talking about a self-generated state, a special state of mind that you generate by yourself. It was nothing like hypnosis or anything like that you produce. But the other thing, more important, is that this self-generated state improved the self-regulatory capacities of the organism, improved the homeostasis. Some people have been doing research on things like the healing of wounds, and they discovered that people who do meditate regularly, their wounds heal faster than the normal people. But it was interesting. I was working with him a number of years besides my training, and I would say that the method was invented by a German doctor called Schulz back in Germany. The method autogenic training is very well known in Germany and in Europe in general, but I call this method that they invented Autogenics 1.0, the basic autogenic, which is close to hypnosis, let's say. It's a relaxation method. Lütte introduced something new. He discovered that there were side effects. Everybody knew that there were side effects, that some people, instead of getting relaxed, felt nervous. Some people felt like crying. Some people suddenly got bad memories from their past. That would happen. And that happens with all the meditation techniques. The only thing is that in the other meditations techniques, they don't say anything, just not to frighten you before you start. And in the autogenic training, they didn't say anything either, until Lütte discovered that those discharges, as he called it, had a very significant relationship with the past life of the patient, with the past traumas, and produced, after a little while, disappear, and was followed by recovery. So he thought that those discharges, they were not a side effect, unwanted side effect, but were the sign that the method was acting and was curing something, was improving. So then I continued working on his line, and I developed what I call Autogenics 3.0, which is a further step. Following Lütte, I learned a lot from him. I worked with him for 10 years at least. And I call it 3.0 for one, you see, if this, you see the picture in my book, you can notice that this is a brain. This is an fMRI figure, and this is the cingulate lobe, the limbic system, and this is the frontal lobe, and these red and yellow spots mean that those regions are activated during the autogenic state, during the meditation. We are actually producing some changes on the brain, as Lute said in Hypothesis, and we knew that we were doing something with the brain just with this time of concentration, but that's the proof. And by the way, I did this study. We are still analyzing the data, but we have some results. But he did a study in the Canary Islands, which they have a beautiful machine, and last modeled MRI machine. Okay, one of the things that I think is important, and it's one of the hallmarks of Autogenics 3.0, is that it is a technique related to other many techniques of meditation. We call those techniques now amplified states of consciousness, therapies by induction of amplified states of consciousness. Why amplified? Amplified because the reason that the person who is doing it properly, a meditation technique, becomes more aware of himself. It's not a question of reducing the mind and concentrated in some pleasant thing, which can be done, right? That's closer to hypnotherapy. That's closest to concentration, to a pleasant thing. We can do that, and we can experience the pleasure or the relaxation induced by these images. But the real meditation methods like yoga, vipassana, which are, yoga is 5,000 years old. Vipassana was invented by Buddha and is 2,500 years old. Transcendental meditation, I think many of you may know. Transcendental meditation was a simplification of yoga that was introduced in North America by a guru named Maharaji, which made, was a tremendous success, and everybody was doing transcendental meditation in the States and even here. And we have now what is called mindfulness-based stress reduction, mindfulness for short, but it's a technique that is also the same. It's like an Occidental version, simplified version of Vipassana. To be a good meditator with Vipassana, you have to be 10 years in Tibet or something like that. It's really hard to do it well. But just to be a good practitioner of mindfulness-based stress reduction, you only need 10 weekends, and which is, is a great improvement. I mean, is adapted. We have a neurofeedback or biofeedback, which is a way of inducing alpha waves, or Silva mind control, you may know, that is not that much used in therapy. And finally, autogenics. We classified all those methods all together. That's why I say that autogenics is a good way to introduce yourself to mindfulness and to meditation. We have many things in common. And the first important thing, in the 70s, like back in the 70s when I was doing this type of learning, meditation was not considered something worth of scientific study. It was considered something fringe. Strange people like hippies were doing that type of thing and sometimes mixing it with drugs. And there was a Dr. Herbert Benson in Harvard in the 70s. He did careful studies with physiological studies with people who were practicing transcendental meditation mainly. He also studied some people that were doing autogenic training, and so that was a method of inducing what he called the relaxation response. In the relaxation response, there was a decreased muscle tonus. The muscles relax by themselves. No, you don't have to try to relax as in other techniques of like Jacobson and so on. This relaxation comes spontaneously. The heart rate slows down. The blood pressure goes down. There is increased cardiac coherence. Benson didn't study this at the time because but the cardiac coherence is a measure of the equilibrium between the sympathetic and the parasympathetic nervous system. There was a decreased cortisol secretion, that is the hormone, the stress hormone, and there is an increase of alpha frequencies in the EEG. There was more and more parts of the brain, including the frontal lobe, were functioning in the alpha wave, which is a sign of relaxation. Relaxation response was just the contrary of the stress response. It was the opposite response. It was the contrary of the fight and flight response. This is the relaxation response. You know, even Time magazine became aware that was very important, and that was very, very fashionable. And that's a particular hypometabolic state with many physiological correlates, besides producing peace of mind and all of that. So, of course, in medicine, that came autogenic therapy, came soon applied to therapy in psychosomatic medicine. Well, applied to treatment of functional medical disorder. And we have, this is one early paper on the autogenic therapy of temporal lobe epilepsy. This is a paper I did, it's a work I did here at the Montreal Neurological Institute when I was here, with Claude de Montigny, was one of my co-workers, Guy Remillard, a neurologist, and Frédéric Anderman. Frédéric Anderman is a famous man on epilepsy. I went to the Montreal Neurological to see him the other day, and they said that this is retired for a long time, and nobody knows for sure where he's hiding, and it's not working anymore. But they still have a poster. They still have his photograph, and the photograph of Anderman and his wife on the wall, saying that they were the two main persons on epilepsy. But we worked with them, and with the autogenic therapy of temporal lobe epilepsy, we treated 24 epileptics for 9 months, divided in two groups. We have a control group, of course, and we have a treatment group. And after the time, the control group did show some improvement in psychological measures. They improved psychological ratings. The anxiety, depression were a little bit better. The temporal lobe epileptics were much better. Also, there was a psychological improvement. The important thing is that there was a great improvement on neurological clinic. The patients were better. They had less convulsive crises, less seizures, and when they had, the seizures were short, which we thought was very important. That means that we are acting somehow in the brain. There was not functional MRI at the time. There's another study, similar study I did later on the respiratory function in chronic asthmatic patients. This my graduate student, Dr. Henry, was repeating more or less the same model. We were treating a group of people with asthma, and the control group did show some improvement, which shows that just meeting once a week with a doctor that listens to you, that improves the asthma, the psychological part of it at least. But the most important thing is that people we treated with autogenic therapy had improved respiratory function. All those measures pneumologists take with these machines, of breathing machines, that I can remember exactly the functional capacity, the vital capacity, the force expiration volume, and another series of pneumological measures improved on the patients. We were doing something, the physiological. Of course, that's everything is an interplay between the neurosympathetic and parasympathetic nervous system, and this interplay was improved, the equilibrium improved. So that was good. And this is a Montreal General. When I finished my training, I spent there for almost 3 years, and working with Avan Lu within the short-term dynamic psychotherapy unit that had opened recently, and also I had my own psychosomatic unit, working with Serge Pikadorov, who was in charge of the CL service, the consultation liaison, and I was treating ambulatory patients with functional medical disorders, like all kind of cardiac, psychophysiological concomitants of anxiety. That was our specialty. Also, spastic colopathy or irritable colon, and so on. It's a beautiful picture. I keep it. how you call that? The arc-en-ciel in French. I can't remember how to say it in English. But then in 78, I went to Spain and I continued there working on many things. As you must know that I am a fully trained psychoanalyst, and psychoanalysts used to frown upon those what they call relaxation techniques, because they say they are techniques that gratify the patient. But this is not true. Is that they are techniques that allow the perception of the inner workings of the self. Let's say. Let's first. We said that there were techniques that induce and amplify the state of consciousness, and we can think first of what is the level of consciousness. The level of consciousness has to be with awareness, has to be with activation, has to be with energy. We have a state of alertness, hyper alert, until coma, going by slumber, and it's related to activation, energy, focusing, and is the reticular activating system. Is the part of the brain that takes care of the level of consciousness. And besides the level of consciousness, we have something else, that is the state of consciousness. In the 70s, there was a great interest, mainly produced because of the drug scene that there was inducing particular states of consciousness, and there was Charles Tart and other people who studied the state, which is related with the contents. What comes to your conscience that does not come usually, but in some amplified or altered, as they were called at the time, you get contents in your conscience that are not usual. You may have access or not. There is a question of flexibility. You can switch from one state of consciousness to another one, and this is related neurologically to the interhemispheric connections, the connection into the both sides of the brain. This is the map of states of consciousness, just to give you an idea. I took this from Roland Fischer, that was somebody at the time. He was investigating a special state of consciousness produced with drugs in this side and produced by meditation in this side. This is the normal state of consciousness. The normal state of consciousness is, you see, this is the external world, and this is the internal world, just in the inside of the circle. And the normal state of consciousness, we are in contact with the external world and a little bit in contact with the internal world. This is the little access to our consciousness that we have, and we could have all that much of perception of everything that we have been storing inside of our minds, not only storing, but transforming, because the consciousness is continuously working. We do not remember the things as they are. We make a new reality continuously. Sometimes it's difficult to differentiate part of the reality that we are remembering, the part of the reality that we live, that we are just creating and inventing. But all this is in the internal. And you see, as it progresses, the T is the trophotropic activation, is the state produced by meditation. We get soon to the autogenic state. Autogenic state is a little bit deeper. You get more in touch with your inner world, but not too much. You're close to the external world. There's this phenomenon of upreaction, which is what Luther was describing as sudden experiences of traumatic events and things like that. The Zen monks, they produce Zen meditation, produce a deeper state, in which it is interesting that Zen describes a phenomenon that is called makio. Makio is the name for a demon. When the Zen monks describe that sometimes they were meditating and suddenly a demon did appear to them just to distract them, just to prevent them from meditating. They wanted to destroy their practice. Usually they were terrifying demons. At times they were beautiful girls. And anyway, the purpose was always the same, just to not prevent him from meditating. We know now that this demon did not really exist, that there was a production of the inner working, there was a production of the internal world, but it was so vivid that sometimes they believed that they had a real hallucination. And of course we have deeper states like yoga, and we have a state that is called the samadhi, that is a state of deep relaxation. We are quite away from the external world, quite far away from the external world. And we may get to the nirvana if you really proceed very good with the yoga meditation and a state in which you are completely disconnected on everything in a world that is always complete perfection. At this point, I wonder if I may ask for your cooperation just to continue, because I don't have a picture to show you. I wanted you, if you want to, those of you who want, I will ask you just to close your eyes for a second. Just don't do anything. Just close your eyes for a second. Stay with your eyes closed. Don't do anything. It's difficult not to do anything, but not do anything, you'll see that your body keeps working. You will see that your breathing keeps working, and you will feel maybe your heart, you will feel that your head keeps working, your brain is producing thoughts, memories, and questions, but you are not doing that. That's automatic. That's something that is happening. Just don't do anything. Just stay like you are without doing anything. For a few seconds, I tell you when to finish. Don't do anything. Just like that. Okay, that's enough. Thank you. That's closing the eyes is a trick, because when we get most of our information from the external world, we go it through the eyes. If you close your eyes, you get in touch with your internal world. Did you perceive your internal world? What you got? Did anybody felt anything particularly interesting? You got thoughts, memories? Anybody fall asleep? Kind of? Okay. If you did, probably you notice that your internal world, you notice that there is a lot of, at times there is nothing. At times the internal world is completely quiet and calm and there's nothing comes. And at other times one gets a lot of questions about many things that I have to do. At other times one remembers. Many times you may feel like asking questions like, what is this man doing, and why should I close my eyes, and type of things. Like our internal world is continuous. Our brain is continuously working. Our brain is an organ that takes care of solving problems. We are always using the brain. Just this little practice of not doing anything, just closing your eyes and just allow your inner world to stay. Perhaps you may perceive something, perhaps you don't perceive anything, it doesn't matter, but just take a few seconds not to do anything. It's in a way, let's say, relaxing, and it's also in a way informative, because you can suddenly remember that there's something you have to do, and so you have a glimpse of what the internal world is like. And this is what happened with the autogenic state. The autogenic state is not only a perception of the internal world, it's something else. You do something. We do a concentration. We concentrate, we do a meditation, and we have three different phenomena. We have many phenomena. One of them is a basic affective mood, which is the feeling of relaxation. I define relaxation as exactly the opposite of anxiety. Anxiety is the vague feeling that something terrible is going to happen at some point. And relaxation is the feeling that everything is perfect, there's no problems, everything works fine. And we get this basic affective mood, this feeling of relaxation. We get usually perceptual enhancement. We perceive ourselves better. And we get, as Luther described, the autogenic discharges, sudden recoveries of past memories. It usually takes some time. The perceptual enhancement is almost immediate. The basic affective mood develops very, very fast, very, very quickly. And the autogenic discharge usually takes time. It rarely happens the first time or the second time. It takes weeks for somebody to start getting this depth perception of himself. We could say, first we said it's certainly a good technique for psychosomatic disorders. It's a good technique for relaxation in anxiety disorders. I use it a lot, and it's very, very useful for generalized anxiety disorders, very useful for stress disorders, very useful also for crisis intervention as a first step in a crisis, the most important thing to do is just to keep calm. And if somebody's in a crisis and you tell this person, well, please, will you keep calm? He will feel insulted because he knows he has to keep calm. But the question is how to do it. Well, that's what we teach. We teach how to do it. What you have to do to keep calm is a method, is a technique. It's a technique that some people say is impossible to do the technique. I say, well, it's impossible. The first is any technique is impossible if you don't know how to do it. If you know how to do it, it's difficult. If you keep trying to do it, it finally becomes easy, becomes really, really something natural. It takes, but we can apply these methods to deeper purposes. We can apply it as a method of psychotherapy, in which we first are training, I would say it's closer to CBT than to psychodynamics or psychoanalysis, although it produces and facilitates insight and self-discovery because there is a lot of training. First training is training in self-perception. The person, the patient learns to perceive himself first, physically, learns to perceive the physical sensations that the body is producing all the time. Second, learns to perceive the feelings. We are producing feelings all the time. And there is a subtle difference between emotion and feeling. Emotion is something that comes suddenly, almost from the outside, ex movere, ex movere from Latin means something that moves yourself from outside, something that is, and you own the emotion. When you feel the emotion, you own the emotion. You take possession of your emotion, and that's one thing that you learn. You learn self-perception of your emotions and your feelings, and you learn free association, which is again the same. In psychoanalysis, they would say, well, you just lie down and free associate. How you do that? In autogenic therapy, we learn, we teach how to do free association. We learn progressively self-discovery, with feelings, your sensations, your thoughts, your inner world. You start discovering, and suddenly you get self-acceptance, which is not an effort. Self-acceptance is the natural consequence of getting acquaintance with yourself and accepting. Conflict resolution is very easy once you stop fighting against yourself. Conflicts tend to solve by themselves if you are aware that you have a conflict. And we have something that I found it very interesting, that is contradictions, which is not the same of conflicts. Contradictions, they are things that they are experiences that are true. We really had this experience. And there are other experiences that are true, but both of them cannot be true at the same time. They are not compatible. It is like a conflict, but it's not really. It requires more a cognitive evolution than an emotional resolution. And you come to the final purpose of all the techniques of meditation, and I would say all the techniques of psychotherapy, that is self-unification, which is the same that feeling at ease with yourself and using all your powers to adapt and to progress in the situation and to enhance your living and the living of the people around you. There is a lot of energy that we're wasting all the time fighting inside of ourselves and trying to doubts and contradictions and so on. This is one of my papers on the theme, that is autogenic analysis, is the name of this type of psychotherapy. And I put the subtitle, "The Tool Freud Was Looking For," which I think was a rather modest title. And I presented this in the winter meeting of the American Academy of Psychoanalysis, of course with a different title. The title was something like Learning Free Associations or something like that. But the idea is, that Freud was trying to get to the unconscious, and he was trying everything. He was trying hypnosis. He was even trying laying of hands in the head of the patient to see if that helped. And finally, he gave up and he said, okay, just say whatever you want to say, do free association. My point in this paper is that if he had known how to induce the autogenic state, if he had known autogenic training, he would have discovered that this is a real good road to the unconscious. dreams are the royal road to the unconscious, but the autogenic state is a highway to the unconscious. You perceive your unconscious as in the dreams, with the difference that you are fully awake. And there is no need for interpretations. The therapist does mostly teach the patient how to do the exercise, how to keep the concentration, how to select, to report those experiences that really are coming from the unconscious, not the many cover-ups and inventions that he does to negate and to not to accept what is coming in. But you don't do, the therapist doesn't need to do many interpretations. Like the patient discovers the experience is clarified by itself in the course of the therapy. So you see, this is it's a very wide technique. We can use it from technical intervention to treat anxiety disorders or to treat psychosomatic disorders. A well-described technique that functions very well. We can use it to treat a bit more complicated adjustment disorders, let's say post-traumatic stress disorders, and we can use it also as a deep psychotherapy that works very well with personality disorders. We're using it with some success with obsessive-compulsive disorders, and even with some difficult borderline personality disorders. The only problem with the technique is getting the patient to do the technique. That's the question of psychotherapy. This is helping, teaching, and helping to do it. Now, I don't know if there's any question at this point of what. I know that we have time for discussion afterwards, but before I continue, I would like to know, do you have any particular question or advice? I forgot. Yes, Sonia. Tell me. May I get questions? Yes, yes. Okay.
Otherwise, they don't hear us at the general. Sonia. And I guess the same applies to the general. If you have any questions or any recommendations, feel free to make some noise. Sonia.
Thanks. In your list of psychotherapy, and you went down several categories, and to me, I was just wondering where emotional regulation.
Very important. Okay. Emotional regulation goes just after training in self-perception, just in self-discovery. Self-discovery, I mentioned. The emotional regulation, I like the word, because we talk about emotional regulation. We talk about emotional control. I don't think those are useful concepts, because emotions are part of ourselves. It's something we have to digest, something we have to transform. We have to take ownership of our emotions. Emotions are automatic responses that are probably produced by the diencephalon, the deeper, more animal part of our brain. They soon get to the amygdala, and which is part of the nerves of the limbic system. They get to the. Let me show you what emotions do. They go to the limbic system. They make all his way through the cingulate, and they finally end up in the orbitofrontal cortex. And if you allow the feeling, then emotion is the beginning of a feeling. Well, when you get an emotion, you can do anything. You can get a cardiac attack. You can start running. You can start banging your head on the wall. You can scream. If you wait, then the emotion transforms itself in an inner experience. And if you wait, this inner experience is sometimes it's pleasant. And when we talk about emotions that we need to control, we're talking about emotions that are not pleasant. We allow those emotions to proceed. And at one point, we discovered that the point that the emotion is pleasant or unpleasant is not important. What is important is that it is your feeling. It's something, it says something about you. It says something about the situation. There is an opinion. It's an opinion that we make with the limbic system, where making opinions all the time with our brain, with our frontal cortex. We're making rational opinions. When we talk about opinions, we talk about rational opinion. But we are also making opinions with our limbic system. And even with our hypothalamus, we're making body opinions. But the limbic system makes emotional opinions, or rather, feeling, sentimental opinions. And if you allow those opinions to go, they transform themselves. My thinking is that there is a lot of nervous connections that are neurons are connecting themselves and are kind of processing, digesting those feelings that finally they transform themselves in information. So that I would call more about ownership of feelings. I use the expression feeling the feeling, experiencing the feeling, not do anything. Just don't do anything. Just allow the feeling to proceed. Don't explain the feeling particularly. And then this, that I have here, these little blue arrows. That's if you stop the feeling, if the feeling does not go through the normal limbic pathway, will go down to the encephalon, and we interfere with the sympathetic, parasympathetic systems, and will produce all kinds of disorders, or physical disorders. If it progresses a little bit more, and it goes out of the pathway, because it's blocked. There is a blocking of feelings, and then the feelings will divert into the motor areas, and people feel restless, feel uneasy. It starts to have behavior kind of activities just to dispel the feelings. There's many things people do just not to feel the feeling, not to have the experience. And if you let the feeling proceed a little bit longer and it goes up in the upper part of the frontal lobe, they will transform themselves in obsessional thoughts. These obsessional thoughts are useless. They are moved by, they're a way of expressing emotions or a way of expressing feelings. But the frontal lobe is not good for processing feelings. The frontal lobe is good for finding out how to get what you want, but it's not good to know what you want. Anger. Anger is a feeling, it's an opinion that means that there is something that is impinging in your way, or something is obstructing your life, and you have to get rid of that. That's all. It's an opinion. You don't have to be, particularly excited because you feel angry. Now, once this anger is digested and it comes to the conclusion in your orbitofrontal cortex that there is something that is interfering with your life and you have to get this person or this situation eliminated, then is when the frontal lobe starts thinking, well, how to do it? The frontal lobe, it gets the solution. The feeling gets what you really want. No feeling is good or no feeling is bad. There are only opinions. I say in my book that there is no destructive feelings. There are only destructive ways of handling feelings. So that's where emotional regulation comes. It forms just a complete, sorry, I didn't put it, but is in the autogenic methods. The first method is the somatosensory meditation, which is the basic. That's the standard. That's what we use for treating anxiety disorders and to treat psychosomatic disorders, and the most simplified. But then we have a second step, that is the feeling meditation. Feeling meditation is what I just explained. It's not easy, mind you. It's the type of thing that once you do it, and you know how to do it, it's very easy. It's no problem. There's no problem. I mean, for me, just to accept my feeling and to experience my feeling, it's very easy. I'm used to do it. It's as easy as thinking. But the first time I did it, and I put it in my book, what happened, I thought I was going through hell. It was a terrible thing. Until you discover that nothing happens. It's just an internal experience, feeling meditation. It's very good to be well trained in somatosensory meditation before you go to feeling meditation. Then we have something in other areas I won't get into, because that would be, you see there are other 4 more methods that are deeper. We have to start with the first one, and then we go to the feeling meditation. That's what you were taking about never mind about controlling feelings. What you want is to own your feelings and to know what the feeling is telling you. The feeling is giving you a very useful opinion about your life circumstances. Sometimes there are life circumstances that are obsolete. We have feelings that have nothing to do with what is happening right now, with current life event. They have to do with life events that took place 30 years ago, but as we blocked the feeling, we blocked the pathway, that they're still trying to get through. They're not digested. And as soon as you allow it to be digested, the whole thing changes. Think more about ownership of the feelings. I use expressions something like feeling at ease with your anger or with your fear. Fear is very easy. Fear is the feeling easier, the easiest feeling to digest, is fear. Anger is a little bit difficult. Sadness, in my experience, that's a little bit difficult. There's a very important feeling that everybody finds in meditation, and it's called longing for love. Nobody ever has been loved as much as he needs or as much as he wants. And then that comes in feeling meditation. They come the feelings of loneliness, of guilt, of not deserving, that many things. But just let them go. Don't think about controlling. Think about allowing the feeling to express itself. I use expressions, I use metaphors, such as telling the patient that he has a dog inside of his head, a love dog, a dog or a cat or whatever his favorite pet is, and that the dog loves him or her dearly, wants to help her, wants to give her information about what is very important in his life. But this information is a feeling. It doesn't know how to reason. It doesn't know how to talk. It only produces feelings. And you have to, everybody says that. Everybody says you have to be in touch with your feelings. You have to recognize your feelings. What I am doing is just explaining how to do it. I teach how to do it. And people usually learn it in a few sessions. But first, they have to take on the somatosensory meditation. Dr. Negrete, your question, please.
I was thinking of clinical practice of your therapy, your method. What about the interference of pharmacotherapy? What do you have as
but I have my important.
Can you repeat the question?
Yeah.
Or maybe I'll ask Dr. Negrete to ask the question again.
Which is an important question.
Yeah, well, right. If you are treating anxiety disorders, for example, do you have any principles to follow regarding the use of medication at the same time as your therapy?
Yeah, I never use benzodiazepines. And when I inherit a patient that is already taking benzodiazepines, I explain to him that just continue doing as usual, your normal prescription, your normal. But as they are doing the exercise, they start feeling sleepy. Is that during the meditation, during the concentration, they complain that they feel sleepy, that they feel slumber. And I then explain to you that, of course, it's because you are taking benzodiazepines. The benzodiazepines are very good to sleep. If I take the dosage you are taking every day, I will be sleeping for 2 days in a row. But you need this dosage because your sympathetic nervous system is very accelerated, but now it's changing. Now you are getting to another state. Now your sympathetic nervous system is not working more than enough, and your parasympathetic nervous system is working much better. And of course, as soon as you get into the relaxed state, you feel that the effects of the medication is too strong, which makes sense. So don't take as much, just reduce the dosage. And I ask the patient I explain the patient, the benzodiazepine is like scotch. If you take a whiskey and that produces more or less the same calming effect, it's not useful, but it's okay if you do it from time to time. But if you don't feel the need of the benzodiazepines, don't take it, or just break it in half, reduce. And often, very often, or always, they decrease progressively the use of tranquilizers. They decrease it. They don't need it anymore, but they keep it for occasional situations or occasional problems, sleep problems. I found it's a very useful way of this habituating taking of people of benzodiazepines, because they do it in an autogenous way. You know, if we want to say that, we never do a kind of a schedule that you take for 1 week, you take 10% less, and then another week you reduce with this kind of obsessional Ashton method. No, they live just freely. Just if you feel sleepy, that means you are taking too much time, so the diazepines just reduce it. Another question is the selective inhibitors, the ISRAs. Oh, by the way, the benzodiazepines not only make the patient sleepy, but interferes with concentration. They find it more difficult to concentrate, not only in the exercise, but in their normal life, and impairs their memory in their normal life. But the selective inhibitors, like fluoxetine or paroxetine, in my experience, do not interfere with concentration. That people are taking selective inhibitors, they do concentrate very well. They achieve, they obtain the relaxed state of the affective mood right away. And I have a number of patients who are taking antipsychotics because they are either bipolar or schizophrenics that are in the remitted state, and they keep the medication, and that it doesn't seem to affect. It doesn't seem to change. It reduces, by the way, it doesn't have to your question, but it reduces the relapses in hypomanics and reduces the relapses in schizophrenics, I think, because many of the relapses are related to stress situations, and they are better reactivity. They take stress much better. The stress reactivity is much less, so that reduces relapses. But definitely, I don't know if you agree with me, that the other problem, I also used the method with a number of people who were taking drugs, illegal drugs, you know, like pot or hash or things like that. And I found it quite discouraging. It doesn't work. So I reduced my practice mainly with anxiety. I love anxiety disorders because they improve so fast that it's a pleasure to see them.
Brain is not the same.
In addicts, you mean? Yeah, probably. Yeah. Okay. Any other question? No? Then how is it done? How we do that? Are you interested in knowing how to do it? How it's done? It's a question. It's very easy training of attention. The whole being calm, inducing the state of calm, has nothing to do with willpower. It has nothing to do with any kind of, in fact, willpower does interfere. If you want to relax, you are going to get nervous. It's as if you want to sleep. If you go to bed and you say, this night I have to sleep, then it's probably you stay awake. It has nothing to do. It has to do with attention. It has to do with attention. And let me tell you about attention management. Attention management is how we manage attention. The natural way of attention is wandering attention. Wandering attention is we think about something else, our attention wanders, and our attention gets attracted to something. Our attention gets attracted to danger. If we hear a noise, we just have the startle response or the orientation response, and that has a very important evolutive value. We all of us that we are here together today, our ancestors had a very good startle response, and they had a very good ability to have their attention attracted to danger. That's why we are here, because those who were peaceful and they didn't pay attention to noises in the forest and things like that, they disappeared. They didn't leave the sense. And so we have a very good way of having our attention attracted to danger. We also have our attention attracted to pleasure, to food, appetizing food, or charming people, or a type of thing, or beautiful things. Our attention just goes to by itself. We also have, particularly we humans, our attention attracted by curiosity, about things that are new, that we don't know. That's natural. So far, you notice that I am talking about attracting attention. We have the expression In Spanish, we say me llama la atención. In English, we say the same thing. It calls my attention. No? It calls my attention. Calls my attention means that there's some external events that attract my attention for one reason or another, because it could be dangerous, because it could be pleasurable, or simply because it's new and I'm curious. Now, we have another type of attention, is the capture attention, or fixated attention. That happens I say that because many of you may have heard about hypnosis, which is a way of inducing a trance, a technical trance. Trance can be induced without hypnosis, can be induced by drugs, can be induced spontaneously. Some people do get into a trance spontaneously and get their attention fixed into something, and they're unable to perceive any other thing. And now we have concentration. Concentration is putting your attention in something because you want to. That is not natural. It's the getting the attention fixed to things that may be dangerous, that are new, and that are pleasant. That's natural. That happens. Concentration is not natural. We all learn concentration. Do you remember when you were in school? Long time ago, when you were little, and you were the most important thing you all learned in school. You think what it was? What do you think it was the most important thing you learned in school? To pay attention. That's right. To pay attention to something you didn't care about. But you pay attention to me now because what I'm saying is interesting, it's attractive, and is new in a way, okay? But when you went into school, the teacher was saying things that you couldn't care less about that, and it was boring. And he was saying, Juan, what did I say? If you were not able to repeat what the teacher was saying, you got in trouble. So you learn to pay attention. You have to make an effort. You learn that you have to pay attention to things that were not pleasurable, that were not interesting, that were not dangerous. You have to pay attention. And that's the first thing. I think that's the most important thing we learned in school, just to pay attention, to be attentive. In my times, it was very difficult not to pay attention in school. I think nowadays, maybe children's it's easier for the children not to pay attention because the teachers are not so cruel as they used to be many years, so stern as they used to be. But anyway, it's something that you have to learn, and this is active concentration. Active concentration means concentrating in something because you expect an outcome. You concentrate to obtain some result. Because if you are not interested in the results, why would you concentrate? I mean, you let your attention wander, or you just don't do anything, but you are concentrating because you want to achieve some results. For instance, if you are doing mental calculation, if I say, well, it was 17 plus 42, and then you concentrate, and you are checking whether you get the results, and you are checking if it works, if it doesn't work, and that's active concentration is the normal way of concentrating we use every day for everything. We're expecting outcomes, we are checking results, and the most interesting thing, we activate the ergotropic system. The ergotropic system, to remind you, is a part of the nervous system that starts in the hypothalamus, that starts in the posterior part of the hypothalamus, was discovered by Walter Hess, a Swiss doctor from Switzerland, who won the Nobel Prize in 1950-something because of this discovery. And the ergotropic nervous system, he was investigating it by electrodes. But Schultz, when he started with autogenic training, where he said, well, you know, it's when if you do mental calculation, if you concentrate to achieve something, then you get the same time of response. You get alertness, you get the increase of conductivity in the skin, and you get many similar things that are related to sympathetic activation. And there's no need to be afraid. There's no need to be stressed. It's simply active concentration does produce the stress response, does increase the ergotropic activity, which is the same that saying it does increase the sympathetic nervous system. Then there is the passive concentration. Passive concentration is another type of concentration. Passive concentration is a concentration that is used in meditation. You would say, if I don't care about the results, why would I concentrate? Of course, there's no need to concentrate. The only reason for doing passive concentration, not caring for results, just concentrate, you concentrate, but it doesn't matter what happened. You do that because you want to learn meditation. The same thing that you learned active concentration because you were forced to, and then that was very useful. Active concentration we use all the time, and it's very useful to be able to pay attention to things that are not interesting. That's how we got all our degrees, when we were able to study. We were putting our attention into boring matters and things like that. And passive concentration is very useful to learn. We never learned that. There's just no use for it. And it's an attitude of total acceptance. It doesn't matter what happened. You concentrate and you accept beforehand. Before anything happens, you already agree with whatever may happen. That's what gives the passive quality. And that produces a trophotropic activation. Trophotropic is the other side of the hypothalamus, or the other side of the equilibrium with the ergotropic. Trophotropic is the part of the hypothalamus that takes care of regulating energy recovery, rest, self-regulation, also things like self-reparation, cicatrization, and also digestion. All type of trophotropic activities are stimulated. Hayes did stimulate it with the electrodes, but we do stimulate those zones with passive concentration. And I have to mention also what we could call disperse. Dispersed concentration is just fluctuating concentration. You think one thing, then you think in another thing, and attention is jumping from one place to the other. That's useless. This is not concentration. So we have these two types: active concentration, everyday life concentration, and passive concentration, which is the same thing, but it's not caring for results. Just concentrate. It doesn't matter what happened. That's fine. Okay, I have here. Would you like to try passive concentration? Is anything? Anybody? What do you think? No? I'll have plenty of times. We'll have half an hour going. Okay, if anybody wants to try, just ask me. It's very easy. Okay, what we do when we are concentrating? We have attention training levels. People say, I am unable to concentrate. How many of you are unable to concentrate? Did you ever try meditation? All of you tried meditation? Or none of you? But most people say, I am unable to concentrate. I cannot. I get distracted. Of course you get distracted. And the first task is maintaining the attention focus. You focus your attention in something. There are many forms of meditation. So people focus meditation on an object, an external object, like a lamp sometimes, or they fix the concentration on internal representation, like any image of something, or a sound, like the mantras, a repeated sound. Mentally, you fix your concentration into something. In autogenic training, we focus the concentration or focus the attention in a physical experience. We begin by training the proprioceptive nervous system, and we concentrate on the physical experience of having mass, which is having weight. We concentrate in the experience of weight, which is the easiest perception. We are always perceiving our weight, but we are never aware of our weight. We concentrate on that perception. And at the same time that we're maintaining the attention focus, we realize that there is some mental activity in the background. Like you are concentrating, and at the same time you realize, because the mind kind of amplifies, the thoughts coming, but that's fine. You are doing what you are doing. Remember the little exercise we did a little bit before when we were closing the eyes and allowing to perceive the internal world? I always do that because that teaches that there are two different things. One thing is what you do with our brain. We are thinking all the time, but doing that. Another thing is what our body is doing, or our mind is doing. Our heart is working all the time. thanks God. And our brain is working all the time and is producing thoughts and memories and images, whatever you want. But we are not doing that. What we are doing is concentrating in a specific sensation. And we are aware that the brain is doing something, but we don't pay attention. We're concentrating on what we're doing. Then sometimes you have to apply a little bit of effort to restrain, to get away from the focus and start thinking about something that came to mind. But that's training. That's a question of training. And then sometimes you catch yourself distracted. You said, well, it's not just that I had something on the background. I start thinking into something that came to my mind, and I start thinking into something without being aware that I was doing it, and I didn't want to do it, but I did it. And as soon as you discover that you did it, you just leave the distraction and go back to the focus. No? Well, anybody who knows meditation knows that. And then you abandon the distraction and return to focalize attention. You do this all the time. I say, and I think it's very useful, that all this is part of meditation, not just maintaining the attention focused, because that will happen to people that have a long training, and they're able to keep their attention focused continuously without any distraction for a long time, but it's not usual. The usual thing is that you go all through the 6 stage many times, and you know that you are doing your training well, because if you catch yourself when you are distracted and you say, okay, don't worry, you don't get angry. You say, I got distracted, I know that happens. Leave the distraction and go back. You are training the different things, and finally, you maintain yourself all the time, after a little bit of training, focused in the experience, focused on the